Good day, everyone. Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. Over time, the tissues on our face undergo a so-called collagen depletion. That's why we can see some wrinkling in the skin or sagginess or volume loss. So this is a physiologic process that will really happen to all of us, both men and women. And in today's episode, we have a special guest, our male client, and his first time to join our video right now. And I'm so happy, I'm so glad that we have Attorney Paul.
Thank you, Doc.
Yan. Sa wakas po, nakasama na namin po kayo for this episode po. Na we could say skin regeneration, okay, or like bringing back the clock of time na we want to reverse the process of aging. Magka-batch po kami ni Attorney. Yan. So, we're professional po yung kasama natin. Okay. Of course, kasi even I go through this processes, this treatment too. It's very important, very significant for me. So, now we're about to do a so-called face mapping. So it's also important to do assessment sa ating face areas. Like we do upper third, middle third, lower third assessment. So for attorney po kasi, and he's very busy, always on the go, ang kailangan niyang mga treatment, yung kung pwede po, yung mga lunchtime treatment, yung walang long downtime, kasi may hearing na naman few days from now, okay? So, in terms of the upper third of the face, okay, I could say na yung natural lang for men, kasi accepted na merong some forehead lines, kasi even the Hollywood actor, they show this, diba silang George Clooney, they have forehead wrinkles, pero it's accepted among men. Parang it adds up to your masculinity. So, yung dito sa forehead po ni Attorney, I could say, okay lang po siya. Yan. And then sa brow area and the upper eyelid, okay, as time passes by talaga, nagkakaroon ng droopiness or sagginess din, yung upper eyelid natin. Okay, the weakening of the tissues in this area. So, parang yung eye natin, medyo droopy. O, yan. Okay? Pero yung vision, 2020 pa. Hindi na.
Pero medyo konti nagba-black.
May tawag kasi doon na attorney yung aging na presbyopia din. Yung, di ba, yung pag tumatanda daw yung nagbabasa ka you're doing like that already. Pero sometimes nga, you see some shadows. Yes. Pero pag nagdo-drop kasi, it adds up to yung, especially when you drive, parang you can hardly see.
The field of vision is
smaller, na decrease na. Yan, that's a good point po. So actually, I would recommend dito sa upper third, some lifting dito sa upper eyelid. Okay, yan. We'll discuss ano ba yung gagamitin nating product to have that result na somehow will pull the upper eyelid upwards, a lifting effect. Now, going to the mid-face region, okay, so kasama na dyan, infraorbital, below the eye area, the anterior medial cheek area, the lateral cheek, and the nasolabial. So, kay attorney po, ang concern here is yung beginning na what we call ptosis or downturning or droopiness na rin ng mid-face. So, because of the pull of gravity na rin and the loss of the collagen, it's starting to go down here and creating yung deep nasolabial fold here. So, kaya nagkakaroon tayo ng malalim na crease here because yung mga tissues in the mid-cheek area, they begin to become weaker. So, it goes down. So, yung nagkakaroon na po ng pabagsak, yung mga laman po dito sa mid-face region. Yan. So, we can do a treatment na somehow, non-surgically, kind of give an effect of lifting the nasolabial fold. Okay? So, dito po sa mid-face. And then, sa lower third, okay, what's happening is we tend to lose the jawline definition here. And then the others, this one, yung jowling. And then the others, yung marionette line also. Okay? So, sa lower third of the face. Okay, attorney, what we're gonna do right now is we'll address muna upper and middle third. We can correct this droopiness here. We can correct also the sagginess here, the mid-face region po. No? Pwede na po. And we wanted to do a procedure na somehow lunchtime, okay, mabilis, and walang downtime. dapat walang bruise, walang challenging walang bruise, walang swelling, walang
Adaptable to the
hematoma, and yes po.
Adaptable to the on-the-go public.
The on-the-go public, like especially po kayo, laging busy. Ang hirap din pong hagilapin. Minsan nakaschedule na, reschedule tayo because I have an important, yun nga po, palaging meetings on-the-go. Yan! So, ating ipakita, ano po kaya ang ating procedure na gagawin? What kind of product are we going to use for our attorney? And what will be the step-by-step procedure nga po dun sa ating treatment sa kanya. Okay? So, ating abangan yan sa pagbabalik ng CC Certified Skin Authority. Back mga ka-CSA. So right now, we'll be showing you actual procedure of the so-called anti-aging or lifting treatment for our guest today. So, we'll be presenting you a material, okay, it's a dermal filler, biocompatible dermal filler, and it's different from the hyaluronic fillers that we have used before. So the one that we will show you is the so-called Radiesse dermal filler, okay. So the Radiesse is made of a calcium hydroxyl apatite filler, and we categorize it as a semi-permanent filler, biocompatible filler. Okay, so actually it has the calcium and phosphate minerals that are naturally present in our system, like the bones, the teeth. So it's very safe, and this is US FDA approved. Even the European EU, it has that mark. It's approved also in Europe, and of course, we should say in Asia also, we've been using this already. I think they had 8 million products already delivered all over the world. So it's been used in the clinics for a very long time already. Okay, ayan po attorney. Meron tayong FDA approval ng ating product. So it's a dermal filler. Okay, and although this is not a permanent type of a filler, over time, it also gets absorbed, or it's also gradually degraded by a natural process too. So the procedure that we will be doing is a so-called bold lift technique, okay, by the Radiesse company. And the target will be for the upper, middle, and actually a portion of our lower third. Kasi when we do lifting already of the upper and middle, nasasama na rin po yung lower. So, anchoring points of the face, mostly it's on the lateral. Doon yung nagkakaroon ng support na nalilift natin yung tissues sa gitna. Okay? For the upper third, the injection points that I will be making use of is this arch of the brow area. Okay, it's lateral to the so-called supraorbital structures here, and then the tail of the eyebrow. What will be the landmark for these two injection points? The first one, for this arch, I make a line from the allar of the nose, okay, to the lateral limbus of the eye area. Yung tinatawag na yung iris natin. So there's a lateral limbus there. Actually, you make a line like that up to this portion dun sa may arch. Okay? So basically, I want to give an injection point here to pull the upper eyelid. Kasi nga po, even I experienced this, droopy na rin yung upper eyelid. Talaga pong proseso nangyayari, right? So we can do an injection point here, exactly at the arch of the eyebrow, and then the tail of the eyebrow. Okay? Particularly on the orbital rim, on the orbital ridge here. Injection points for our Radiesse in the upper third of the face. So middle third naman of the face, what we're gonna need here will be the zygoma. Anatomical landmark here will be the zygoma area, zygomatic arch and zygomatic prominence. Okay, for the zygomatic arch here, I'll palpate for the groove, the so-called groove here, this part here. So that will be an injection point also. So third injection point. And then the prominence here, the malar prominence, that will be a fourth injection point. And then like 1 to 2 cm anterior to that zygomatic prominence is the anterior medial cheek. I'll be giving also an injection point here. Okay po. So may anatomical landmarks po tayo dito, Tony. What I will be avoiding is the infraorbital foramen here. It's a danger zone because it has infraorbital blood vessels and nerve. So ina-avoid natin yan. So what will be the exact anatomical landmark? Actually, it should be from the infraorbital rim about 10 mm. Napaka-exact pa, no? Mid-pupillary line. But to be very, very exact, it's actually the medial limbus. So, straight lang pong line yan. Pwedeng mid-pupillary na lang. And then about, I should say, like a 10 millimeters, like a 1 cm like this. And then that's an X region. So, X region na po yun. We don't inject there. Now, my 6th injection point will be the piriform fossa, this part here. Now, what we avoid here is the angular artery from the facial artery that traverses towards the sides of the nose. So, when we inject this part, we go deep so that we don't touch the artery that's lateral to it. Okay, anatomy po. And then actually, there's also a last injection point whereby we also can do the chin. But ideally, we do this pag po walang ano na po. Here. Okay. So next time, actually, we'll be doing another jawline episode for attorney sa susunod na po yun. So what we're gonna be working first right now will be the upper middle part of the face. Then coming soon po, yung sa jawline definition and then the chin projection. So I'll be doing 1, 2, 3, 4, 5, 6 injection points, making use of my Radiesse. It's the so-called bold lift technique. Okay, so I'll be using a 1.5 cc of my Radiesse. So the good thing with the Radiesse right now, they have the product with the lidocaine. So it has enhanced comfort na po. Before, we had the Radiesse without the lidocaine. So we still have to combine lidocaine pa po. But right now, the good thing, Merz already gave us the Radiesse Plus, meaning to say it has the lidocaine with it. It's very important to observe asepsis, antisepsis, or make sure that the
eye,
yes,
ano naman iniiwasan doon?
the eye area. Okay, that's a very good question also. I mentioned kanina po, like if we're doing the forehead part, so we have to avoid supratrochlear structures and supraorbital structures here. And then in the medial part of the eye, the medial canthus here, we have angular artery, the end artery of your facial artery. We also have yung mga infratrochlear, and then branches from the ophthalmic artery that comes out here po. So it's very important to avoid also this area here because it has a lot of anastomosis ng mga blood vessels, arteries po, and veins. Because it's very important, as I was explaining sa other episodes namin, that filler injection should really be done by trained doctors. And they have mastered anatomy po talaga. Kasi a lot of vascular accidents happen if the one injecting is not well trained or does not have an idea about the anatomy of the face. Kasi po, if you do really a study on the face, it's full of blood vessels eh. Marami po yan eh. That's why with the face structure, super duper, very careful po kami talaga. Especially po, abogado ang kausap natin. So, mahirap na po. Kaya kailangan maging maingat din po. But of course, we want these treatments na non-surgical. Kasi right now, people don't want surgery talaga. They don't want to go through the knife. And mayroon pang general anesthesia na napakaraming complications din. So, we wanted a procedure na minimally invasive and non-surgical and walang mahabang downtime or pahinga po. So, we can do injections lang po as long as we know what we're doing. Okay po. So, that's very, very important. Dito naman, pagka dito sa anterior part of the face na, I've mentioned na infraorbital blood vessels and nerve po. We have to avoid that. Okay, so probably we'll show na the actual procedure sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So we are now using the Radiesse Plus, a dermal filler for bold lifting of the face. So I'll be starting at the arch of the brow. So I'll be avoiding the supraorbital region here. So there's an actual dent here that I can use to be my landmark. Okay. So I need the cotton with alcohol, please. So this is a Radiesse. I'm using a Terumo needle gauge 27. So up there, okay, I'll be injecting directly. Inhale, exhale lang po. And the goal is to be able to reach supraperiosteal region. Okay. And then, I normally aspirate for the reason that I want it to be very clear of the vessels. Okay. And it's just a few second aspiration. Okay, there you go. And then, actually, I have a feel of the periosteum already, which is the bone. Okay, so I'll be injecting 0.1 in this region only. So the push is just a slow push. So this kind of a filler has a very good viscosity and very good cohesivity. So I'm just pushing slowly. So we're not in a rush. Okay, that's a first injection point. Okay, okay lang po. Okay. Now, next one will be, the second injection point will be the tail of the brow, but we need to be exactly on the orbital ridge. Okay. So, I'll be palpating for the periosteum here and then injection again. Inhale, exhale lang po. We can use cold compress on the other side to reduce some discomfort, like an ice gel or ice roller. Okay. So I need to reach for the periosteum. There you go. And then again, it's my habit to really aspirate, to really make sure that we're clear of any vessel. Okay. So another 0.1 at this region. Okay. Pushing a 0.1. Okay lang po. Inhale, exhale. Okay, pushing the medicine. There you go. So 0.1. Okay, so we're done with the arch of the brow and then the tail. So it helps also to give comfort to our patients to like do some cold compress on the other side. So I need dry OS, please. And I will be proceeding to the zygoma region, this part here. Right now, there's a saying, less is more. We don't want to overdo. We just give the right amount of filler. Okay. So I need to palpate for the groove here. So I'm directly on the groove. Okay, the groove here, and then injecting. Okay, I need to reach for the periosteum. Okay, there you go. So aspirating, and then negative for some blood flow, and then pushing. So I'll be giving a 0.1 again here. 0.1. Okay. Next will be the prominence, the zygoma prominence, this part here. So again, injecting here up to the supraperiosteal region. Okay. And then aspirating, negative. I'll be giving 0.15 at this part. So I have now a 0.1. And then another 0.05. Okay, there you go. And then my fourth injection point, anteromedial cheek. It's part of the so-called mid-cheek groove. So it should be lateral to the infraorbital foramen. We wanted to avoid the infraorbital blood vessels and nerve. Okay. So this part here, one way to avoid that is sometimes I put my other finger to block that infraorbital foramen. Okay, so blocking that part and then injecting laterally to it. Okay, inhale, exhale lang po. And then I can give 0.1 here. So I'm protecting the infraorbital foramen already. And then aspirating again. Okay, so pushing a 0.1 here. So since we're doing our male bold lift, we wanted the cheek to be not really so puffy. We just want it to be like the right curve, right contour. So I only need 0.1 here. And then the last one will be the piriform fossa here, sides of the ulnar. Okay. So pang 1, 2, 3, 4, 5, 6 injection point na po. So we wanted to correct the groove here. The nasolabial fold here, we wanted to correct. Okay. So ideally, I wanted to pull the skin like this, laterally, so that we can avoid the angular vessel from the facial artery. So to protect that, we can retract the skin laterally like that. And then, our needle towards the piriform fossa. Inhale, exhale lang po. Okay, medyo, the needle lang, okay. I need to reach for the fossa. Okay, I'm already in the fossa. Okay, again, I aspirate. And then I can inject 0.2 at this part to lift this nasolabial fold here. So I'll be pushing more here. Okay, so that's my 6th injection point. Okay, so we're done with the right side, and I still have a 0.75 mil of my Radiesse. So far, so good po. Back mga ka-CSA, so we're done with the Radiesse bold lift technique. Okay, so we did total of 1, 2, 3, 4, 5, 6 injection points, targeting upper and middle part of the face. So a while ago, we have shown you yung isang part na treated and the other side na untreated. And with this kind of a simple technique, I could say it's a lunchtime treatment, you could already achieve some result. Okay, so I think we'll show to attorney na po yung resulta. Kasi promise ko sa kanya, dapat wala siyang bruising, walang swelling, because meron nga po siyang appointment this coming days. So ito na po ang ating mirror, attorney. Okay lang po. Yan. So far, so good. Okay. On the go treatment, merienda treatment, coffee break treatment, right? Yeah. Kasi what I have noticed already, especially dito sa may nasolabial part po, a while ago it was deeper.
Deeper, yes.
Yes. So with the filler injection, actually I injected like a 0.2 for that side. We already noted lifting. Okay, so this is a very good filler, a versatile filler with this volume lifting and contouring effect, and as well as it can give skin rejuvenation din po over time. Okay. Yes, that's the important thing also with the Radiesse. It has collagen production. Yun nga, yung intro ko kanina, as we age, as time passes by, we get collagen depletion. So, with this type of Radiesse, if you want to stimulate collagen formation, you can make use of this. And this coming weeks or months, we notice some improvement pa sa skin texture, tightening and firming. And we only use like a 1 box ng ating Radiesse, the 1.5cc Radiesse Plus na may kasama na pong lidocaine. So ngayon, it has an enhanced comfort already. Hindi na po kami nag-a-add ng lidocaine injection prior to the procedure because the lidocaine itself, when we inject, it stings. It's kind of uncomfortable. Okay, attorney, ano pong masishare natin sa ating mga televiewers?
Well, I would recommend to undergo such procedure pero sa qualified.
Exactly po.
Qualified because as Docs explained, may mga vessels and whatever that could easily be penetrated pag unqualified yung and to boost confidence because siyempre lalo na sa mga persons that usually have meetings or nakikihalubilo sa mga madalas sa mga tao, maganda rin naman na may na-enhance kahit paano yung confidence times.
Yes po. Yeah, kasi I was asking attorney, how significant din po ba like sa kanila na very busy people to undergo non-surgical procedures like this? And yun nga po, next thing attorney na it's also helping us to boost our confidence. And same thing with me. Yeah. Like I talk to a lot of people.
Doc, kasi you get lively.
You get lively.
Pagka, ano ka, kasi pag pagod ang itsura mo, nakakaawa sa ibang tao. But if you're lively, lively din yung kausap.
Pag nakikita ka na tired looking, haggard, or so stressed, o yun, parang...
They put a negative effect.
Right, yeah. Kaya kailangan positive effect. Ito ba yung mga positive look, and yun lang, happy look lang.
Doc, tanong lang ako, about the any contraindications?
So after this procedure, since we did a simple technique lang po, injection technique with the Radiesse, well, For you po, actually, hindi naman po kayo yung that sensitive kasi we've done procedures po attorney na before and I've seen him na for few days lang naman ang swelling. The others, I advise avoiding heavy or strenuous exercise, especially yung mga masyado kaming maraming nilagay or masyadong marami kaming in-inject na products. For you po, kahit mga mild exercises, okay lang. And in terms of the diet, hindi naman po kayo allergic sa any types of food. Wala naman pong so much. Because the filler itself po, may studies sila, these are hypoallergenic din, non-immunogenic. So, no worries po kung yung sa mga allergies, tapos kung mga physical activities. Kung siguro po I did a lot of injections, I'll advise avoiding heavy or strenuous activities. Pero dahil medyo meron din tayong 6-point injections, na bolus type of injection, ano na lang muna po, minimal or mild exercises lang po. And then, yung others po kasi male, they're asking me, Doc, okay lang ba ng, hindi naman po si attorney. Pero may mga male po kasi, as long as you're not into any oral medications, okay lang.
How about oral medications for maintenance of?
Yeah, for some of my patients na they feel some discomfort or pain, you can take analgesics. Kung hindi naman, just do ice compress lang. And then because this is, we've observed asepsis, antisepsis, hindi naman talaga to, required to take antibiotics. Okay, and of course, we don't want to develop a lot of bacterial resistance, so as much as possible. As long as we have aseptic technique, malinis naman, sterile and filled, no worries for bacterial infection. Important kasi we have to avoid infection. Ayan, attorney, we really appreciate your presence. Actually, meron pa tayong follow-up with you po, and magkakaroon pa tayo ng future episode with you, yung namang ating jawline contouring for men.
Kailangan ko ba magpapayat nun, Doc?
The jawline contouring. Actually, we advise talaga yung healthy lifestyle, the right diet, avoid too much calories. Of course, as we age, bumabagal ang metabolism, kaya kailangan the right diet lang po, balanced, healthy diet. Okay po. So, I think, yan, okay naman po. I can see a result right now. I'm so happy. Okay?
Actually, lalo na sa kilay.
Yeah, it seems like there's already an elevation already. Ayan. Sa inyo po na may mga katanungan, you may email us at csaskinclinic@yahoo.com or send a message at our FB page, CSA Derm Centre, or Instagram, CSA Derm Centre. Our clinic is located here at the second floor, Pure Gold Building, Dauma MacArthur Highway, Mabalacat, Pampanga. Contact number 04533-11117 or 0933-860-9193. So, ang mga episodes po namin, inyong pang mapapanood sa aming YouTube channel, Contessa Salvador. So, maraming salamat po sa inyong lahat. God bless you. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.